Hi, I'm Kelly Beingesser. I work in Fresno, California. Patient choice is the most important thing. No one wants to morcellate any cancer, whether it's a sarcoma or a routine endometrial cancer. So patient choice is very, 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 very important. You must really assess a patient's ability of having cancer. You have to rule out any kind of cancer to every single extent that you can before you take a patient to the operating room. And realize that it happens about 2 out of 500 patients, 1 or 2 out of 500 patients, and you need to know what you're going to do, how you're going to do it, and keep your patient safe.
I'm Summer Nahas. I am a gynae oncologist in Great Toronto area in Mississauga Credit Valley Hospital. Personally, I never liked the idea of morcellating, despite the fact that it's related to sarcoma or not related to sarcoma. Just the fact that there was a lot of scattered tissue at the end of morcellating. I always thought of putting it in a bag and morcellate it either through the vagina with a knife, with the morcellator, or through a mini laparotomy through the belly button that's absolutely invisible. It's just safer, cleaner, and it will take even less time because you have a better control. And that's my personal opinion.
But Dr. Nahas, what do you say of the very large fibroid that might require a bigger mini laparotomy?
Never bigger. Just do 2 centimeters right through the belly button, right in the middle. Come down all the way up. You'll have 2 centimeter incision using through the umbilicus, and then you use one of the small elexes that will stretch it to about 3 centimeter incision. It's for any fibroid, as long as you keep grabbing and keep morcellating with the knife or faster with the morcellator, but it's in a bag and it's through the abdominal cavity.
Alright, so you are advocating for using the power morcellator as long as we do it through a bag,
right,
safely,
absolutely,
without any spillage in the cavity.
Right. The whole idea of not using it for possible sarcomas is the tiny pieces that you leave behind, and you can guarantee not leaving any pieces if you do it without a bag. But if you do it with a bag and you do a clean surgery and clean cut and you don't cut through the tumor, you're absolutely safe.
Alright, so this was Dr. Summer Nahas from Toronto, a gynecologist-oncologist. Thank you.
Hi, my name is Frank Garcini. I'm a minimally invasive gynecologic surgeon in Chicago, Illinois. The current situation with morcellation has not changed my practice in any way. We've always been very careful about selecting our patients. We have followed the guidelines that have been submitted by AAGL and ACOG and take those guidelines very seriously. So we've been doing that for many years, and fortunately the guidelines that came out were in step with everything that we've been doing, so we are not going to be changing our practice in any way.
So if you have a large fibroid and you're doing a minimally invasive surgery, are you going to open a mini laparotomy, or are you going to use a power morcellator for the large fibroid?
It depends on the size of the fibroid and the texture of the fibroid, and of course we will be screening these patients very carefully to make sure that we have selected someone who is at low risk for a malignancy.
Okay, so you would still consider power morcellation in a select group of patients?
Absolutely, absolutely.